Guys, welcome to the lecture on assessment. This is my favorite one to talk about because this is really why we're learning about phonetics if you're going to become a speech therapist is for assessment. So let's get into it now. Let me just share my screen. Okay. Okay. So let's talk about assessment. So there's differences in terminology that everybody should be aware of. Some of them are very fine differences. So a screener is used really to decide if further evaluation is necessary. And a screener can be standardized. So for example, there's an assessment called the PLS, and it's a language and articulation together. So it's a very brief screener for speech sounds because sometimes you're doing a very quick screening of all the skills at once. An evaluation is done after we've decided, after we've finished the screening and decided that further evaluation is necessary. And although people use evaluation and assessment interchangeably often, evaluation is really meant to decide if a person qualifies as having a speech disorder or delay and determining eligibility for services. So evaluation we do at the beginning of the process. Assessment is ongoing. Okay, so we continue to assess students for their progress reports. If they're insurance patients, we continue to assess them so that insurance will continue to pay for their services. So assessment continues as long as you have someone on your caseload. Okay, as I mentioned, there's different types of screeners. I mentioned the PLS. This is an informal screening tool. It's not standardized per se. It doesn't have norms, but it is a very quick way to assess what speech sound errors a child has, what sounds they may be missing from their inventory. It's very user-friendly. It's an app. I used it quite a bit during COVID when we weren't going into the homes. And I posted a copy of the protocol for it into the Canvas shell for this week, just so you could see what it looks like. Okay, so this is a list of some of the activities involved in an assessment. Now, you may not be doing all of these, okay? It really depends on your setting that you're in, and it depends on whether some of these tests have already been done. So, for example, hearing, many times children come to you and they've just had a hearing screening. So if it's a school, the school nurse would often do a hearing screening. If they're coming to you from a medical setting, often the pediatrician's office has already done hearing. But you may be working in a setting where you're going to be doing a hearing screening. That is completely possible. Sometimes depending on the age of the client, we may not do an oral mech, and we call it oral mech for short, oral mechanism exam. Especially if we're just meeting children for the first time. It can be a little bit invasive, and sometimes they have trouble following directions for that. So I'm going to go through each one of these right now, but I just want to let you know that you may not be doing all of these for each individual, and sometimes you may not be doing them in this order as well. So let's talk about that. Okay. So the first one on the list is case history. Okay, so case history, first of all, we want to find out if there's any risk factors. So for example, family history of speech disorders. That's important because often speech and language disorders, there is a family history. There's some genetics involved. So that's a good thing to find out for risk factors. Health history is important. So if there's a history of ear infections or a fluid in the ears, when we talk about hearing loss a little bit later during hearing screenings, we'll talk about how important that is. We want to know if there's anything structurally going on. Did they have problems with feeding, like tongue or lip tie? Um, Certainly, if they had cleft palate, that's going to affect their sounds. Certain types of syndromes as well will affect the oral area as well as breathing. So it's important to know that. Also, if there's any co-occurring concerns. So often we're not just doing speech assessments in a vacuum. Sometimes you may just be doing a speech assessment, but often you're looking across all the domains of language when you do an assessment. You're looking at receptive and expressive language. You're looking at pragmatics. You're looking at their voice quality, fluency. So we don't often just look at speech, but sometimes we do. If you're in a private clinic and someone comes in and they're just concerned about a few sounds, you may just do a speech assessment. It depends. Um, one of the important things for a case history is when we're deciding whether, I'm going to say a student is eligible, we have to demonstrate that a child's speech disorder is affecting them in their daily life and in their education. That's part of the eligibility requirement. So a case history is really important because you have to gather that information from other people often, because you're only getting a very short snapshot of a child. Um, Parent input on intelligibility is very important because you're, again, only getting a quick snapshot. Sometimes you may not have access to do an observation, so having input on what that child sounds like in different settings is very important. And you want to find out what are the specific details about the concerns because we always want to include that in our reports. What was the reason this child came to see us in the first place? And also understanding if there's some specifics that can guide us in our assessment. So, for example, a parent comes in and says, my daughter doesn't produce her R sounds correctly. That kind of helps us know what we're looking for even before we meet the child. Okay. So in the assessment process for speech, we're often doing citation testing. So citation testing, as you can see, is usually a child looking at pictures and labeling them, and then we are transcribing what they said. And as you could see in this example, this is a copy of the Goldman-Fristow assessment. It's a wide age range it's used for, so you'll definitely at some point come across it. And as you could see, there's a target for the word. This should look familiar from your transcriptions. And then you're listening for sound. So in this case, you're listening for the initial and the final sound for many of these exemplars. And then you're recording here whether it was correct or whether, what the error was. And I put in the Canvas module for this week a copy of a document from the test manufacturer. So you can kind of see an example of how this is scored and why it's important that we're learning IPA as well. Okay. So citation testing is usually, as we saw, based on presentation of a picture. Sometimes if a child doesn't know what the picture is, especially a young child, they might not have, sufficient vocabulary. Sometimes we will just prompt them and ask them just to say the word, but often we go through it and allow them to spontaneously label the pictures. Some of the advantages of citation testing are it's standardized. So that means that everybody who delivers it is delivering it in the same way. So that makes it more reliable and valid. It provides norms. So it provides norms for children compared to other children their age. So this is important because we want to see whether they're meeting their milestones. And we also often need to provide a standardized score for eligibility. I'm going to talk about that in a minute. So if it's required by law, we have to use some type of standardized testing. They're very efficient. We can get them done in a pretty reasonable amount of time. They're really good for kids who are highly unintelligible because you know exactly what they're supposed to be saying for each one of the pictures. Some of the disadvantages is there's limited productions of sounds in different positions. So it might not be accurate for capturing all the exemplars of when a child misarticulates the sound. Um, they're often biased, so sometimes someone is, not an English language speaker, their native language is something different. They're not from this country, so even some of the pictures may not look familiar to them. So there's some inherent bias in the tests. And sometimes it can be difficult for a young child to sit through. So the Goma Fristo is a very long test, and it can be really hard to get through that whole test. Um, these standardized tests should never be your only source of data, especially if you're working with children who speak a different dialects or are English language learners. So I put in here a link for a great resource from Charles Sturt University. I mentioned it before when we were talking about when speech sounds come in, because they've provided the most recent analysis of speech norms. But they also have wonderful information, including speech assessments for many different languages around the world. Um, it is the law that a child is entitled to have a speech assessment in their native language. So this is a really great resource to have. And the other advantage, or the reason we use these standardized citation tests, is because it's often required, not just by school districts, but also by insurance companies. Okay, so laws are different by different states. So California state law says that the student is eligible for special education speech therapy services if they have a speech disorder that interferes with communication or attracts adverse attention or impacts their educational performance. So this is why it's helpful to have that case history, because we want to make a case that they're eligible. And it requires, an assessment. Okay, so there's different ways that different assessments are scored. I think we've talked about this before. So two-way scoring is just usually like a plus and or a minus. So it's correct or incorrect. That's all that you're doing. So often in a very quick screening, you might be doing just, plus and minus. Five-way scoring is more detailed. We're going to go through that in a minute, and that's really kind of identifying what type of errors they were, such as omission or substitution. And then IPA is obviously our highest level of scoring, where we're providing much more detail. So five-way scoring, these are the 5 ways that's correct or is incorrect by these 4 ways. So they substitute one sound for another, they omit a sound. The sound is distorted. So if we think about those diacritics that we talked about, distortion might be, if a sound is nasalized that shouldn't be, that's a distortion. If a sound is lateralized, that might be a distortion. And then addition, we talked about the phonological process of epenthus. So that would be an addition error. Okay, so just an example with one word. So we're moving from 5-way scoring into IPA scoring to kind of show you really what the advantages are. And each articulation test is going to be a little bit different. So if you were doing a more extensive IPA scoring, as you could see, you rather than just marking it correct or incorrect, and rather than just identifying what the error was, you're also then talking about what type of error it is. Kind of similar to our homework this week, right? So in this example, if cheap was pronounced as teep, it's incorrect. We can identify exactly what the error was, but then we can also identify that it was an error in place and manner. And the advantage of this is that as you go through time, so let's say you're assessing this child multiple times, you can see if there is progress, even if they're still making errors. So for example, if instead they did seep, then we could say, okay, still an error, right? But now we're at least progressing, because now it's just an error of manner instead of place and manner. And then similarly in this last example, now we've gotten to the point where the child has the same manner in place and it's just a voicing error. So we're improving, they're getting closer and closer to what the target should be. So that's the advantage of this more detailed scoring. So another thing to keep in mind is we want to identify, and we call this differential diagnosis, of whether the child has an articulation disorder or a phonological disorder. So when we use the word articulation, we're talking about the production, either correct or incorrect production of individual phonemes. So you can have just an articulation disorder and have only one sound affected. So the most common example is kids who can't produce the R sound in its many variations. Okay, so it's one sound that they may have trouble with, but as we know, there's many different ways that you're producing R, whether it's pre-vocalic or all those vocalic R examples that we saw. So phonology is rule-based, okay? So in English, for example, we have to have a vowel in every syllable, except for those exceptions with the syllabic consonants. We have constraints in where sounds occur in a word. So voice consonants will always end a syllable with the preceding voice consonant, and vice versa. Voiceless consonants will always end a syllable with the preceding voiceless consonant. So if you had a word like cats, and then ducks, cats and ducks. So even though we orthographically represent plurals with the same letter, sometimes it sounds like a s and sometimes it sounds like a z. This is phonology in place. It's a rule. When we talk about phonological errors, we're talking about those patterns of articulation errors that we just learned about, like fronting, or backing, where an entire group of sounds is affected. It's not just one sound error. So fronting, all the back sounds will often be affected until the children are able to remediate it. Okay. And this distinction, this diagnosis between articulation disorder and phonological disorder often comes into play when we're choosing a test. Okay, so sometimes articulation and phonology are within the same test. So for example, there's a test called the CAP, and you go through and you do a citation testing for sounds and words. And then there's a checklist where you're going to transcribe the errors to see if there's a pattern. So that's all in one encompassing. Sometimes there's specialized tests for phonological processes. So the HAP, which was mentioned in chapter 10, was one of your transcription exercises. That is a test which is specifically looking at phonological processes. And then there's another option where two tests work together. So the Goldman-Fristow test, which I mentioned, is an articulation test, but then there's a test called the Kahn-Lewis, where the results of the Goldman-Fristow are overlaid into this other test. So they can work independently or they can work together. Okay. So the chapter went into great detail about taking a speech sample. I can tell you most of us now just record it on our cell phones because cell phones have increased in the accuracy of the microphones. But if you're in a clinic setting, you may have specialized equipment available to you, or if you're in a hospital. So just keep that in mind that many of us are using our cell phones rather than specialized equipment. So speech language sample, most of the time it is both a speech and language sample, okay? And 99% of the time, you're going to want to do this. The times that you're not is if a child just doesn't have enough language to provide a sample, right? So the younger the child, the less likely you're going to be collecting a sample. So we use this for many different things. We use it to come up with an intelligibility score because we really want to listen. What do they sound like in connected speech? What do they sound like with someone who's familiar versus someone unfamiliar? As I mentioned, it's always part of these comprehensive assessments. It allows us to hear the sounds in connected speech, which may be different than, one word at a time in a citation test. It's going to allow us to hear those same sounds that were on the articulation test in different contexts. An articulation test can only be so long, so it's not going to capture every single context that that sound could occur in. It can be used to identify delays in other domains. So if a child has prosody issues, you're going to hear that in a language sample, for example. And it's also going to be used for morphology analysis. So way at the beginning of the semester, we looked at counting morphemes in words. So you're getting that from the language sample. So language samples are very useful. These can also be used for eligibility. So I read you the eligibility for California for speech. There's eligibility in the law, there's eligibility language in the law specifically related to language disorders. So for language disorders, there are specific instructions that you need a standard score that's 1.5 standard deviations below the mean or the average. And they're looking for 2 or more standardized tests. So this is where those citation tests could come in, because that would count as often as a standardized test. But sometimes in those cases where a child can't sit through a standardized test, you have the opportunity to make them eligible based on an elicited language sample. So just something to keep in mind how it fits into the whole process and special education law. So this is talking about schools specifically. Okay. So intelligibility, as you guys know by now, is how much does someone understand a person? So maybe different than speech sound accuracy, right? Especially in connected speech. Kids get a lot less intelligible in connected speech. As I mentioned, it's important if you're doing on-the-spot intelligibility testing to know what the person is saying. But I think it's even more helpful to have a checklist from someone who knows the child well and someone who's less familiar. So if I'm doing an assessment, I may give a checklist to more than one checklist to the parent, and I'll ask them to fill it out and ask someone less familiar, can you give it to the child's teacher or even another family member who doesn't see the child on a daily basis? Here's a link here to this wonderful Charles Sturt University, which gives us so many free resources. They have one that I use all the time called the Intelligibility and Context Scale. And the amazing thing about it is they also have it in many different languages. So if you're working with family, English is not their first language, then you can give it to them in their language. Okay. So let's talk about observations. It's great if you can do an observation. Again, it gives you an opportunity to hear sounds in connected speech, to look at intelligibility in different environments, look at those other domains of language. And it's also going to help you kind of put together that eligibility statement, which is how is this impacting this child in their daily life? So if they're not speaking up in class, for example, if they're not interacting with their peers because they're self-conscious about their speech delay or disorder, that's good information to have. You don't always get to do an observation. Sometimes it's a timing issue. Sometimes schools, private school may not let you come onto their campus. So it isn't always possible, but it's great if you can do it. All right. I mentioned we were going to talk about hearing, doing a hearing screening. Always good to find out, at the start, did they pass their newborn hearing screening? Is there a history of hearing loss in the family, in the child? If you're in a medical setting and the child has a syndrome, there's certain syndromes which affect hearing and they affect it as in a regressive way. So the child starts out with adequate hearing and then loses it over time. So Usher syndrome is one of those. History of ear infections with fluid in the ear can affect, the ability for that child to hear sounds. So this is important. We have our little speech banana here, which shows that if a child has even very mild hearing loss, it can affect some of these sounds. So that's going to kind of say, oh, well, my child had many ear infections. They had to have tubes put in their ears, but they didn't pick up on it until they were older. That's going to be really helpful because you're going to be kind of fine tuning your listening ear for these sounds that would be most affected by it. Okay. All right. Another thing that I mentioned we don't always do, lots of times I don't do this, or not to the extent that you might with an older individual, is an oral mechanism exam. We call it oral mech for short. So this is really for you to look at the articulators. So when we think of our placement of our articulators, we want to think about, is there anything in that individual's articulator structure that could be affecting their speech? So, for example, for young children, if they've lost their front teeth, that's important because there's certain sounds where they need those front teeth to be able to touch their tongue against, right? So if you think of f or v, for example, or the th sounds, teeth are important for those sounds. Moving more, thinking about the manner how we make sounds. A child who I'm going to bring up syndromes again because many times with syndromes you have different parts of the body being affected. If they don't have enough breath support, that could be affecting their speech. We just mentioned the oral cavity, the tongue obviously being very important. So there's certain disorders. One is called dysarthria, where there's weakness that could affect their ability to precisely move their articulators. Um, Obviously, hard and soft palate. If a child has cleft palate, they're going to be affected. And this is really where this is a functional assessment of this whole entire speech mechanism. Okay. All right. Stimulability testing is important. I would say most of the time it's done after you're done with your assessment, okay? There's often not enough time to do it during the assessment. So once the child qualifies, you're going to be giving them services. You really want to dig deep into what sounds they might be stimulable for in different positions. So in the beginning of a word, at the end of the word, in the middle of a word, with certain vowels, you are going to do some stimulability testing, okay? And this is really helpful for creating goals. Um, and you usually use what we call a stimulability probe. And that's it could be broad if they have a lot of sound errors, or it could be very narrow. So I put an example of a broad one into the Canvas shell and a narrow one, an article about why we want to do probes for R in different positions. Okay. Another thing we want to do after they're often after the eligibility, but important for developing goals is a phonetic inventory. Sometimes we may do this as part of the assessment. It depends. So for very young children, for example, I work with early intervention children, they may have a limited number of sounds. So the parents may tell me, oh, they don't have a lot of sounds. And I'm going to ask them, well, what sounds do they have? That's taking their phonetic inventory. And that's important because looking at this chart, going to the right-hand corner, we know that children are more likely to produce words with the sounds that are in their phonetic inventory. So we want to know what sounds do they have so that we could pick targets. So even though this class is about speech, there are areas where speech and language overlap, and that's one of the examples. I posted an article, I think I posted it in an earlier week, but I posted it again into the Canvas shell for your reading pleasure, if you want. And it kind of goes through why we can't use standardized tests, so citation tests, to come up with a phonetic inventory. Because often, for us to say that a sound is in a child's inventory, we really want to have more than one production of it. So many of the tests only have one production in one position. So it's just not enough for us to tell whether they really have that sound mastered. Another problem with some of the articulation tests is they don't assess vowels. So some of them have you transcribing vowels, but they're not scoring it. So it's important for, especially for younger children or a child who is distorting their vowels, so a child who has a motor speech disorder, that we're looking at vowels for particular populations. And then lastly, a standardized test can be difficult based on the syllable stress. So initial consonants can be difficult to produce in unstressed syllables. So we want to give the children the ability to produce sounds in monosyllabic words often because that is the easiest. Because remember, we're trying to assess, where this child breaks down, what phonetic context can they produce the sound. So that's where phonetic inventory really gets into that fine detail. Okay, so I just want to go into, and I'm going to do this in class as well, but in case any of you do not make it to class, I want to share with you this week's module. So if you look here, there's resources from ASHA, but there's a screener that you can look up just to kind of see what it looks like. The intelligibility scale that I mentioned. There's a stimulability probe here. There's information on specifically R. So what would be all the different versions of R that you would look at, why you want to do that. There's an example of what information you're gathering in an oral mechanism exam. And then oral mech, as I mentioned, for young kids can be difficult. So this is just to give you an example of a fun visual that we use sometimes with young kids to get them to participate in an oral mechanism exam. This is a link for the multilingual assessments. And then this is the article about why it's difficult to use standardized tests for that phonetic inventory. Okay, so that is it on assessment, and I will see you in class.